At the recent Integria Symposium, we discussed the role that natural medicines can play in helping the patient with cancer. And one theme that came up rather consistently throughout the weekend was this interesting concept of the cancer hallmarks, the hallmarks of cancer, and how I believe they can inform and both validate natural therapy approaches to supporting the patient with cancer. So I thought it would be worth doing a research update on this because there has been a new significant publication on this topic just last year. So I'd like to take you in part one of this presentation through the two earlier papers about the cancer hallmarks from Hanahan and Weinberg. And then in part two, I'll update you with Hanahan's 2022 publication on the cancer hallmarks. So as said, there are three important papers, and whether it's by design or by accident, you'll notice they've been published 11 years apart. So one wonders if we'll have to wait till 2033 for the next installment. So it was in 2000, the year 2000, that Hanahan and Weinberg published their landmark paper that has been highly influential. And indeed, they help us identify points of potential therapeutic intervention and indeed preventative intervention in cancer. So originally in the 2000 paper, 6 hallmarks were proposed, providing a logical framework for understanding cancer's remarkable diversity and why cancer cells are so different from normal cells. And as mentioned, it was seen to help identify areas where priority targets for preventing and treating cancer can be identified. And then in 2011, Hanahan and Weinberg expanded on their initial hallmarks to include 2 more. They also pointed out 2 enabling characteristics critical to cells being able to acquire these 8 hallmarks. And they added an 11th factor, so 8 hallmarks, 2 emerging out of those 8, 2 enabling characteristics, and then a kind of an overriding consideration or component, which was the crucial nature of the complex tumor microenvironment in the development and indeed perpetuation of the cancer cell phenotype. And as mentioned in 2022, Hanahan on his own updated, and the 2 the emerging hallmarks from the 2011 paper were confirmed as core. He added 2 more emerging hallmarks and 2 extra enabling characteristics. So that means you now have 10 hallmarks, of which 2 are emerging, 4 enabling characteristics, and of course still this overriding consideration of the tumor microenvironment. So that now brings the number up to 15. But let's begin at the beginning. So this was the first paper published by Hanahan and Weinberg in Cell in the year 2000, and you can see there in the diagram there are 6 hallmarks that they identified at the time as being defining hallmarks for cancer cells. So if we look at the 2 up the top, self-sufficiency in growth signals and insensitivity to anti-growth signals, and that means that cancer cells just keep on growing. They hit another tissue. Normally, growth would stop for a normal tissue. If it hits another tissue, cancer cells don't, they keep on growing. And this leads us then to the 3rd hallmark of tissue invasion, and then even metastasis, which is relocation of the tumor cells at distant sites to the primary tumor. the fourth hallmark is limitless replicative potential. So normally when you get body tissue cells and you culture them in a test tube, after a few rounds of division, those cells will stop dividing, they'll stop replicating, and that's known as the Hayflick effect. But cancer cells just keep on going; they're immortal, you know, in lab Petri dishes. The fifth was sustained angiogenesis. So as a tumor grows and it's rapidly growing, it needs to feed itself with blood supply, and it harnesses the blood supply mechanisms of the body to do that. And then the sixth one was evading apoptosis. So normally when a cell is faulty in the body, it should kill itself. It should commit suicide in a controlled way, which is called apoptosis. But cancer cells seem to evade apoptosis, even though they're highly abnormal. And Hanahan Weinberg said, we foresee cancer research developing into a logical science where the complexity of the disease described in the laboratory and clinic will become understandable in terms of a small number of underlying principles. And of course, these 6 were originally proposed. Then the follow-up paper, 11 years later, they identified 2 emerging hallmarks. Now, these emerging hallmarks, I think, are very important for anyone interested in natural therapies because they're highly informative. If we look over to the right, avoiding immune destruction. So in other words, the immune system should play a role in eliminating cancer cells and indeed, ideally, cancer tumors. But cancer cells seem to be able to avoid this immune destruction, even though the body has mechanisms to recognize them as abnormal. Then on the left, we have the deregulation of cellular energetics. So this is known as the Warburg effect. And Warburg, of course, proposed this, I think, in the 1930s, and then it went out of fashion, and it's now back in fashion. But it's not just the Warburg effect, it's a whole aspect of how the cancer cell gets its energy in ways that are different from a normal cell. So the principle of the Warburg effect is that cancer cells use glucose and mainly just use glycolysis and producing lactic acid as a result, even though there's plenty of oxygen around. And normally we only do glycolysis and produce lactic acid in a deficiency of oxygen. So it's called aerobic glycolysis as opposed to anaerobic glycolysis, which is the norm. But it's a lot more than that. Cancer cells can exploit fatty acids in different ways to a normal cell. They love amino acids and they feed off amino acids. And then we have 2 enabling characteristics that feed these 8. That's very informative to a natural therapies approach, that inflammation feeds and drives both cancer development and the sustainment of cancers. And then there's a genomic instability and mutation, mutating all the time. And I'll touch on that a bit more soon. So I used to think, before I really got into the research and indeed began reading about the hallmarks of cancer, that a cancer cell was formed when you had 1 mutation. So you get 1 fatal mutation and suddenly a normal cell turns to a cancer cell. Well, in fact, they identify that for most cancer cells, there has to be 4 to 6, maybe more, critical mutations for them to turn cancerous, all describing features that are represented by the cancer hallmarks. And indeed, they find some cancer cells have more than 100 mutations. And it's this genomic instability that feeds these multiple mutations that can turn a cell into a cancer cell, and what's more, can help that cancer cell evade any attempt at therapy. Also, as mentioned, in this second paper in 2011, they highlighted the importance of the tumor microenvironment. And again, this is really important because it could well be that a healthy body will not support a cancer because the terrain is hostile for cancer cells to form. So it shifts the focus, the tumor microenvironment shifts the focus from the abnormal cells to the condition of the whole body. If we count the enabling characteristics and the tumor microenvironment, there's up to that point, there was 11. The original 6, the 2 emerging, and the 2 enabling, and the tumor microenvironment. So there was an interesting project called the Halifax project that I might do something on at some stage in the future, where they actually got a range of natural products, mainly herbal extracts, and looked at all the research on which herbs actually addressed all of these 11, if you like, cancer hallmarks. From a test tube, admittedly, and probably small effects, and there'd be questions of access to an organized tumor. So there are all of these issues. But it does speak at least to cancer prevention, this findings of the Halifax project in terms of natural phytochemicals that can target all of these 11 cancer hallmarks. So this has generated a lot of interest, as mentioned, in drug development, and you can see targeting the hallmarks of cancer is going to lead towards a rational approach to next generation cancer drug therapy. It's a powerful guide for research aimed at improving early detection, screening, and treatment. And it's important to note that in order to develop and evolve towards malignancy and invasive status, cancer cells must acquire most of those modifications of the 10 hallmarks of cancer. And secondly, only cells with high developmental plasticity, such as stem cells and progenitor cells, can sustain this complex scenario of changes. And then the third lesson, as I've emphasized, is that cancer development requires feedback interactions between cancer cells and their microenvironment. So this paper, which I've elaborated on in this slide, discusses how the hallmarks are informing our understanding of cancer from both a theoretical perspective, but also a therapeutic perspective. It's interesting also, this paper came out in 2015, and it was looking at how the hallmarks happen over time. So you're talking here not months, but years, and that some of the enabling characteristics or hallmarks are thought to occur early and then feed and get added to by other hallmark changes. So if we look up the top, genomic instability is a critical issue. And what that speaks to is it says if we are really wanting to prevent cancer, we have to understand ways to make people's genomes more stable. And it's quite interesting that if you look at some of the research of improving genomic stability, herbs like green tea and ginkgo come out quite strongly in that regard. So if we have better genomic stability, then we're less likely to get all of these other effects that then come in, all these other hallmark changes that come in over time, and you can see them there. And particularly later on, once you get some of the hallmark changes like deregulated metabolism and resistance to apoptosis and evasion of antigrowth signals, then it's thought that this then feeds the abnormal cells and encourages them to form a tumor via some other critical hallmark issues, which is the tumor promoting inflammation and the immune system evasion. And of course, the tumor microenvironment plays a later role there as well. So thank you. That's part one of my discussion on the cancer hallmarks. And in part two, I'll be looking at the 2022 paper from Hanahan with both extra enabling characteristics and extra hallmarks. So stay tuned.